Key messages for us: workforce growth, and I'll do some more numbers on that. The biggest issue is the massive numbers. As you saw earlier, 800,000 workers for aged care over the next 20 years. Now, it's going to cost to equip 800,000 people. So nobody's talking about this. You don't get a politician glimmer about, oh, we should do something about that. I had one senator say it's the elephant in the room, but she didn't do anything else with it, so it's still the elephant in the room. Clearly, services are designed to keep people well and out of hospitals. So the other major shift is to get people improved out of hospitals and look after them in their homes and communities. As I mentioned, a lot of changes about consumer-directed care and person-centred service models are expanding. And I think NDIS is going to be the interesting one, because that's probably going to be the fastest, quickest way of looking at that. And I think for those of you who work in the disability space, there is significant change coming, and there's going to be a lot of organisations who won't make the cut. And there'll be new organisations that pop up and merge and converge. A lot of integration across community services and health. And I should keep on hammering, the disability is a classic example, that if you're as a disabled person or the carer choosing the sort of care, you don't want to bring in a physio and then the next day bring in a doctor and the next day bring in a registered nurse and the next day bring in a speech pathologist. You want someone who can come once and do it all for you. So we're going to have to look at more generalist, I think, models of professionals, not only at the degreed professions, but also at the support role vet professionals. And I'll talk a bit more about support roles later. Quality and consistent delivery of training we've spoken about. Shift to a combined tertiary sector. As I mentioned earlier, paramedics are lobbying frantically to become a degreed profession, because they're trying to follow on from the nurses who did it 15, 20 years ago, to move from diploma on the job to a degree in a university. Sorry? They are paramedics already degreed, are they? So nationally they're trying to shift to degreed, and there'll be other professions that will take that step. There's also a lot of national lobbying around physicians' assistants. If you've been following the press, Health Workforce Australia likes it, the Standing Council for Health Ministers likes it, probably the AMA doesn't like it, so it's not going anywhere at the moment. But they're looking at new roles which are not traditional roles and are, I guess, at the support level, even though physician's assistant will probably have a degree or an associate degree if it gets up. And progression of the workforce development agenda, and I'll talk a little bit more about that later. Talk about the money. It's always important to talk about the money. And I hope that we're still working on future projections, because once you start looking at the future, there are, for some areas, there are about 6 different data sources, and they're all different. So